Hi and good evening. I am Dr. Eric J. Klein, a doctor of medicine. Today we are going to discuss about tuberculosis or TB. What is tuberculosis? Ano nga ba ang TB? TB is caused by a bacterium, Mycobacterium tuberculosis. Take note, this is caused by bacteria and not a virus. It usually attacks the lungs, but other parts of the body can also be affected, including the bones, joints, and brain. Yes, you heard it right, including the brain. But what are the symptoms and signs of TB? The symptoms of TB includes general weakness, panghihina, weight loss, pagbagsak ng timbang, fever, and night sweats o yung pagpapawis sa gabi. In pulmonary TB, the symptoms include persistent cough or ubo ng ubo, coughing of blood, ang pagdura ng dugo, and chest pain. In young children, however, the only sign of pulmonary TB may be stunted growth or failure to thrive. How is TB transmitted? Paano nga ba naisasalin ang TB? TB is spread through the air when people with the disease cough or naubo, spits, nadura, or sneezes, nabahing. Because it is highly contagious, it spreads rapidly where people are living in crowded situations, masisikip na lugar, are poorly nourished and cannot obtain treatment. Children can contract tuberculosis at any time after birth. Who are the populations at risk for getting TB? The disease is most commonly seen in adults, but affects infants, children, adolescents as well, and is often more serious for younger people. Infants are more likely than adults to contract miliary and meningeal TB, which attack vital organs that are usually fatal or nakakamatay. Countries with high TB burden include less developed countries. The Philippines is a high TB burden country. Then how is TB treated? Paano nga ba ginagamot ang TB? Patients with TB requires extensive and long-term care. Ibig sabihin, pangmatagalan ang gamutan. Many people who do not adhere to their treatment course long enough to be cured becomes resistant to anti-tuberculosis drugs. Kaya yung mga tao na hindi tinutuloy yung gamutan, nagkakameron sila ng resistance. Sa susunod na magkameron pa ng treatment, hindi na gumagaling sa ordinaryong antibiotic. Kaya dagdag na ng antibiotic dahil nagkakameron ng resistance. Siya po ang sanhi ng pagkameron ng resistance, yung hindi pagtuloy pag-inom ng antibiotic. In response, the DOTS or DOTS strategy was developed for both treatment and control. DOTS stands for Directly Observed Treatment Short-Term Course. It's a standardized short course of chemotherapy. How is TB prevented? Paano nga ba iniiwasan ang TB? National routine immunization programs use the Bacille Calmette-Guerin or BCG vaccine to prevent miliary and meningeal TB in the first years of life. BCG vaccine protects infants infected with TB from progressing to more dangerous forms of the disease and gives them some protection against the recurrence at a later age. BCG does not prevent TB itself. BCG does not prevent TB itself and provides little protection against the pulmonary form. It is not recommended for adults. Again, BCG is there to prevent the development of miliary and meningeal TB in the first years of life. BCG does not prevent TB itself and it provides little protection against pulmonary forms, and it is not recommended for adults. Again, this is Dr. Eric J. Klein. Good evening and may God bless us all. Thank you.